Hi guys, welcome back to my channel. So I'm now 9 months on T, and hi if you're joining for the first time. Um, my name is Gary. I'm 21 years old, and I'm transitioning from female to male. So yeah, I just like to do these updates every month, just to, like tell you how I'm getting on with it. So yeah, I usually just do like my physical changes, mental changes, and then like updates are relevant to my transition. So yeah, I think you know the drill at this point. So don't mind me just like filming in bed. I've honestly not had a great day. I'm so tired. I'm like really struggling with my sleep right now. I have started like actually medication for that because I was saying it's my doctor. It's not like normal kind of like one-off struggling with sleep. Just like an actual issue now. Like I really can barely turn up for like, you know, get up for college, working, that kind of stuff. And yeah, I don't know if you watched my last couple of videos, like update videos, but I think I might have some kind of like insomnia being caused by like, I don't know, depression or stress or um my doctor reckons I could have ADHD, so at the moment I'm trying to get like a diagnosis for that, but it's a little bit of a process. But yeah, I'll go into more of that later on. Anyway, so yeah, physical changes. So definitely things are just like slowed down. In general, things are going to be more gradual, I'd say, from now on. Like no crazy changes, I'd say. Um, my beard hair definitely is probably the main thing. It's definitely like more visible. That's really good. Because I was kind of waiting on that for ages. And I know it's not like a proper beard, but definitely you can see it more. Like it's actually like properly visible. So I just have to keep like being patient with that, and like hopefully I'll have a full beard soon, which will be awesome. Um, and tummy hair. What you I definitely have like more of a like sorry, like stomach hair going up, and like much more than I did, and it's getting darker, which is really good. Um, and yeah, my shoulders and like my back and my chest have definitely got more like oil and kind of acne. I've definitely had to shower way more. Not to like I wasn't showering, but like definitely much more than I used to. I usually had to shower like or sorry, I could get away with showering like maybe once every 2 days, but now I have to shower like every day, sometimes even twice a day, especially if I've like done any exercise, because yeah, I absolutely reek if I don't. So yeah, and definitely more use of like um deodorant, because yeah, I just don't smell good if I don't. So I have to kind of get on that more. And yeah, I have a lot of like poppers, so obviously don't pop them because it'll just make the acne worse. But yeah, it's been very tempting not to, because they're actually like, oh, it's so many of them. And, oh, it's so gross. Sorry about that. Probably TMI, but anyway. Um, and I don't really get like misgendered anymore. I think I pretty much passed like 90% as a guy now. During the summer, I noticed like I always got like miss or man, which honestly surprised me, because like it was kind of like a weird 50-50 thing, where it was honestly like I wasn't sure if I was gonna get like called ma'am or sir. And I think definitely I get more sirs than ma'ams. And like I honestly don't remember even the last time I got called miss or anything. I think that was like during summer at the airport, and I don't know, cause like I had a facial hair. I had like short like like a kind of a mask hair pattern anyway. So I was wearing shorts, and you could visibly see like my hair. And like not that women kind of like have short hair or like like can have body hair, but like I was looking very masked that day, I thought, and like I had a buzz cut and everything. I don't know why I was misgendered, and it was really annoying me because it happened like multiple times at the airport. But anyway, yeah, it is what it is. Hopefully I won't get that as much anymore. Voice cracks, I like still get that, which is a bit annoying. But hopefully the longer I'm on tea, a bit like the beard hair, that will go away. Or not happen as much, because like even like cis guys get voice cracks. So yeah, I just have to be patient with that. Yeah, I think honestly I just have like good genetics for passing. Like I have a lot of hair anyway. Before I even like transition, I have like quite dark features anyway, so that's quite helpful for like passing. I think I had like quite masked features even like for a woman before I even started transitioning, so that was definitely a big help. Um, and yeah, that's pretty much everything physically. I don't really have anything much more to update. regarding that. So I think I'm just gonna move on to like mental stuff or like any emotional changes. So yeah, I just started new, like SSRIs or like antidepressants. What do you call it? So the ones I take on were like little blue things. They were like kind of a type of Prozac. I'm on like a different thing. I think it's called something Excel, and my doctor was um, like just see like if it's helping you more. And I'm not sure, but like definitely I think I've noticed my mood is like not as intense, and I just had to kind of just if you take exercise, like I know they suck at first, but like just be patient and trust the process, and they do kind of work. They do work. They're like quite effective, or like highly effective. Like there is evidence. You just have to trust the process and give them time. Like, I've noticed I don't have like as intense like emotional like sadness. Like I often get like things where I'd feel like hopeless, like literally like just crying in bed or just like sitting down in the shower and feeling like worthless and crappy and like what's the point? But like I just kind of like now I know how to like move forward from that, and like I can't really describe it, but like I just don't get that anymore, like, or at least not as much. Like I don't get those kind of hopeless or like really intense depressed moments. I just kind of like I'm good at like just moving on from it and like not getting those kind of feelings down, and like they just are thoughts at the end of the day. They're not like helpful, and the cruelest person out of anyone is like yourself, and you don't realize how good you're doing until like somebody says it from like a third person. So yeah, your brain is like your own worst enemy. So definitely they are helping a bit. You just put me on new ones because just a slightly higher dose, because they were like taking a very long time to kick in. They were working, but just like I think she just wanted them to like um what you call it. I think just they were just so slow. Like I think she just wanted them to kind of kick in a little bit quicker. So definitely they are helping. And then what was it? Yeah, she just put me on new ones as well. So she said they might be a little bit more effective for people with ADHD or like suspected ADHD. And like even if like I don't need them, like what's the word? Like I feel a lot of it is probably coming from like not just depression. I feel it's coming from like undiagnosed ADHD. So yeah, I think they're just helping me at the moment. Maybe not long term, but like we'll just see. I'm definitely doing much better than I was a year ago. That's for sure. And yeah, just a ADHD diagnosis. I've tried a few places, as in like emailing them, but their places are just so booked up right now. I did get into one place that is actually near me, so I won't have to do like really crazy travel to like the other end of the country or anything. So that's really helpful. I just need to like get back to them and like organize a date for the first assessment. And the prices are actually not too bad, and I can get like discounts under like my medical scheme thing, so that's really good. And I do have my doctor helping me out with that, so yeah, that's really good. Sorry, I just have like a list of stuff to help me, like just bullet points remind me of my stuff going on. And yeah, so I'll probably have an update next time for that regarding like ADHD diagnosis. Because yeah, it definitely is crippling me right now. Like the support I am getting at the moment on medication is helping me, but like I think I definitely need more support. That cause definitely is like crippling me. Because I'm having like one good day for every like 10 like bad days. So yeah, my motivation, all that stuff, not great. I'm trying my best. Anyway, yeah, therapy is really helping me out right now, even though it's also a bit like medication in that center is in it's not overnight. It does take a while, but it does definitely help. So I think with medication therapy, it does get better, if only a little bit. So I really recommend that if you can. Just yeah, just kind of like transition updates, not necessarily medical, but just well maybe some medical, but just like kind of stuff about like I don't know family and stuff like that. So yeah, my family just not being great. My dad doesn't really want me to transition at all. Um, my other family are like, I don't know. I think they're just like a bit confused because it's such a like new thing to them. I don't know. Like they're kind of like being a bit weird about it, like not really saying anything. Like not coming out specifically saying we support you, but also not like shunning me. So yeah, I think they're a bit like I don't know weird about it. But anyway, like it's not really my problem. Like it would be nice if they support it, but like I don't really care to be honest. I have a good doctor and she's really good. She's like a trans like healthcare doctor, and yeah, it's she's giving me a lot of like emotional and like mental support and like medical support. As I think I said last time, like it's much easier for me to get tea now. I don't have to like send a prescription off to the UK and then like I have to bring it to my chemist and all this kind of stuff. It's just like I literally go to my doctor and like she gives me the sorry, she sends the prescription herself to the pharmacy, like literally next door. So I literally have to go into the room and then I can go home. And like the doctor's like 20-minute walk away from me, so it's literally perfect. Like I probably could not have it any better. Um, and and yeah, if I just had that from the start, it would have been a whole lot better. But it is what it is. I'm just happy I have it now. Yeah, I have a lot of like really good supportive friends. So I'm super grateful for that, and they're like helped me so much. I'd be lost without them. My surgery is like taking so long to like get anywhere with because I would probably have to like rely on the private healthcare system. What was it? But that costs so much and is a lot to like organize and like it'll probably take a long time to get dates and stuff for that. I don't know when that's even gonna happen. So my other alternative is like going through the public system, but like I could be on a waiting list for like a year and a half. Best case scenario, like I could be on it way more than that. I probably will be on it way more than that. So I don't really know. I think I'm just gonna get every single thing legally changed, like bank, all that kind of stuff. Anything I haven't got finished yet, and then I'll probably like look into contacting doctors. But I will have to like raise the funds or see can I get like a coverage or some kind of medical insurance or something like that. Because I believe there is some kind of like overseas thing because I think there was like a doctor in like Galway or like a surgeon or something like that, but I don't know if they still accept new patients. So as far as I know, I probably will have to go to like Spain or Poland or something like that for surgery. So I'll keep you updated on that, but that will take a while, unfortunately. So I'm just gonna like focus on anything else and then probably look into like the surgery. And then the my sleeping is like not great. Yeah, I just have these new medications and what was it? They're very like gentle. I just take one before I go to bed. So hopefully they will help a bit. It's just my problem isn't really falling asleep. It's more just like I tend to wake up a few times during the night, which is really annoying. And then like I can't get back to sleep. And then I'm like, okay, I'll just try like wake up at like 6 or 7. And I'll just go about my day. But then I just end up crashing, and then it like ends up worse. Sorry, because I like don't wake up again until 12, and I just feel so groggy for the rest of the day. And it's like literally like it's ruining my life. It's so annoying. I can't like get anything done. I'm just have all these terrible days, and I don't know what it is. If it's like some kind of subconscious underlying stress, or like if I'm doing something wrong. Because like I do go to bed at the same time every day. Like I do try my best and like set a calm thing, like not looking at screens or anything. I don't know what it is, like what the root cause is, but if it doesn't get better, I'm gonna like say to my doctor and see if there's some kind of like other way. So I'm just gonna give these a try and see do they help at all. So I'll keep you updated on that. What was it? And yeah, I think like the last thing I feel this might be quite relatable, but yeah, I'm just finding like dating hard. I'm like kind of struggling to find anybody because like when I was a girl, like before transition, it was much easier for me to date people. Cause what was it? Yeah, I don't know. Just people kind of tended to be more interested in me. But since I started transitioning, like I don't know if it's just like a social thing or something, or like something I'm doing wrong, but I just haven't had anybody, like literally nobody has been interested in me that I know of, or like that guy's so cute, and like it makes me like so crappy because like I know it's not like the be all and end all to be in a relationship, and like it actually didn't really bother me at all when I was like when I was a cis girl, like before transitions, because I don't know, I didn't like feel it was like my whole self-worth, and now it's almost like bled into like it's my whole self-worth, and I feel like so jealous. And I think it wouldn't bother me if I cis, but like it's like I just feel so crappy because it's like um I don't know, it's just like they're not accepting the real me, and like what if I made a mistake and all this. I know I haven't made a mistake, but it's just like this kind of voice in my head where it's like, oh, you can't be loved because you're trans, and like nobody's gonna find you attractive, and nobody's gonna want to date you, and nobody likes you as a guy, and all this kind of thing. They're just like these horrible thoughts in my head. So that's why I think it hits different if you're trans. And like the only people who's like actually been interested in me is like weird like chaser cis guys, and like nobody has actually liked me for like being me really. And I don't know, I just feel like it's probably like, I don't know, some internalized stuff, but like I just feel like people are just interested in me because I'm trans, not for who I am. Or even like if cis guys are just genuinely interested in me, it's just because like I'm trans, even if they're not. And it's just like I have so much like work to do around that. And I don't know, maybe I'm not like in the best place for a relationship anyway, but it's just like no one has been interested in me, or like, and it just makes me so crappy when I see like girls being like, that's cis guy, or like guys or whatever, like that, or they won't say cis guy, but like that guy's so cute, or like what was it, or he's so good looking and all this, and it just makes me like feel so crappy. And like, oh, just, yeah, sorry, I know I'm like venting a bit, but I hope maybe like people relate to this. I don't know, comment down below if you do. But yeah, anyway, sorry, I like kind of trail off a bit. It's just like, yeah, I think that's just like one thing that's been hard for me since I transitioned, and I can't really put it into words, but I think it definitely does hit different if you're trans. So yeah, just like, yeah, comment down below if you relate. Anyway, I think that's everything. Um, yeah, so yeah, if you enjoyed this video, like, let me know. And I don't know, if you have any questions or anything, just comment down below. So yeah, thanks so much for watching. Sorry, I know it was a little bit unstructured. I tried to structure as best I could. It was just like, yeah, I just like, I feel like this is like my monthly therapy session where I just get everything off my chest. Because I don't have like a lot of people who like would probably want to like listen to me ranting. But yeah. Anyway, thanks so much for watching. I'm sorry this video went on a bit. Oh my god, 60 minutes. But anyway, thank you so much. And yeah, if you have any questions or anything at all you want to say, just comment down below. And if you liked the video, just like, I don't mind. Anyway, thank you for watching. Goodbye.